let's look at the gram-positive non-spore forming bacilli. And we call them regular because they stain uniformly and there's no pleomorphic shapes. And we're going to look here at the Listeria and the Erythropele Pelotrix russipathiae. That's a mouthful. Okay, Listeria monocytogenes. This does not form spores and it's gram-positive. And the shapes can be anywhere from coccobacilli to long filaments. They have 1 to 4 flagella, but they have no capsules, and they are resistant to cold, heat, salt, bile, pH extremes. Their virulence is their ability to replicate in the cytoplasm of cells after inducing phagocytosis. So they avoid the humoral immune system. Now the primary reservoir is the soil and water and animal intestines. It can contaminate foods and it also can grow during refrigeration. Listeriosis is usually associated with dairy products, poultry, and meat. The immunocompromised patients, fetuses and neonates, it can affect their brain and meninges with a 20% death rate. To diagnose it, there's a lengthy cold enrichment process that you use on the cultures, or you can use these rapid diagnostic tests. Ampicillin, trimethoprim, sulfamexazole, those are all used, and to prevent it, pasteurization and cooking. Okay, this big word, Erythropelothrix russipathiae. This is a gram-positive rod. We find it in animals and in the environment. The primary reservoir is in the tonsils of healthy pigs. So anybody that's working with animals or carcasses or meats is a great risk of getting this. This would be like slaughterhouse workers or butchers or vets or farmers or fishermen. It enters through the skin abrasions and it multiplies and makes these dark red lesions. Treated with a vaccine for the pigs and either penicillin or erythromycin. You see the red patches. Now, the non-spore-forming bacilli that are irregular means they're pleomorphic and they stain unevenly. And so we're going to look at these different genera here. First, the Corynebacterium diphtheriae. They're straight or somewhat curved rods. They taper at the ends, and there's a lot of pleomorphic variants. The reservoir is healthy carriers. There's a potential for always being exposed to diphtheria. Most of the cases are in non-immunized children that are found in crowded, unsanitary conditions. It's acquired through respiratory droplets. There's 2 stages of the disease diphtheria. First, there's a local infection where it's going to inflame the upper respiratory tract. That's the primary infection, and you're going to have a sore throat, nausea, vomiting, your lymph nodes are going to be swollen. Then there's this pseudomembrane that forms, and this can cause asphyxiation. There's also a secondary infection that will happen that's cutaneous diphtheria. The diphtherotoxin production and toxemia targets the heart and the nerves primarily. That's horrific looking, isn't it? To treat it or prevent it, there's a diphtheria antitoxin, penicillin, erythromycin, and of course the vaccine series and boosters. Then we have the genus Propionibacterium. And like the Corynebacterium, morphologically, but it is aerotolerant or anaerobic and non-toxigenic. This is what's going to cause acne, and it can also be involved in infections of the eyes and artificial joints. So infection by the Corynebacterium diphtheriae causes a pseudomembrane and respiratory distress and can be prevented with a vaccine. True or false? True.